Shilpa Gupta from Cleveland Clinic. Welcome to Nashville. We're glad to have you here at our Your Amigos live meeting. Thanks for being our social media correspondent. We just finished the bladder session. I want to talk to you about maintenance therapy. Talk to us about what is the current standard of care for advanced bladder cancer.
Thank you for having me, Brian. So the current standard of care is platinum-based chemotherapy followed by avelumab maintenance for patients who do not progress on the platinums.
And how much chemotherapy do you give up front? Do you always give 6 cycles? Is it on a per patient basis?
It used to be 6 cycles was my preference, but based on the Javelin Bladder 100, I've tried to stop at 4 cycles and start the maintenance therapy after that.
So you stop at 4 cycles for all patients?
For all patients,
okay.
Yeah.
All right. And so if maintenance avelumab is the standard, how are we building on that? What are some of the trials ongoing to build on that standard?
So this trial we are doing through the cooperative group MainCAF trial, which is building upon that with cabozantinib to see if it is better than avelumab. Primary endpoint is overall survival. And there's some other smaller trials going on with other novel agents. So the field is rapidly evolving.
And why do you think immunotherapy worked in a maintenance setting, but it didn't really combine well with chemotherapy up front? What are the unique features that made it work in that setting?
Yeah, that's I think the chemotherapy priming and patient selection for the maintenance was the trick, because none of the frontline chemoimmunotherapy combinations have panned out. So we're still learning about the biomarkers.
Yeah, and there aren't biomarkers to select for patients in the maintenance setting. You're giving it to all patients.
Yes.
Okay. And so where's the field going after that? When you have a patient who fails maintenance avelumab, what's your next treatment?
It's enfortumab vedotin or sacituzumab govitecan, depending on the patient's comorbidities.
And if EV pembro moves up front, we talked a lot about that combo, does maintenance avelumab go away?
I think that's a great question, and initially if it gets approved for cisplatin ineligible patients, it might go away in some patients, but EV pembro has also got its own share of toxicities, and gem carbo might be more appropriate for some patients.
Thank you. So sort of a new and evolving standard of maintenance therapy in bladder cancer. Thanks for coming, Shilpa.
Thanks, Brian.